Good afternoon, everyone. Good evening if you're back east, or good morning if you're somewhere else in the world. I'm Gary Small. I direct the UCLA Longevity Center, and I want to welcome all of you to our webinar this afternoon. Before we get started with our guest and what we're talking about, I first want to throw out some thank yous. Of course, thank you to all of you for joining us today. Thank you to our Longevity Center staff, the Semel Institute, IT team, our board of directors who provide tremendous support, as well as our many donors. Now, speaking of donors, these webinars are free. They're open to the community. We love doing them, but the center does rely on philanthropic support to keep us going. And that allows us to provide all the educational programs that we offer our members, the community. And so if you're interested in making a donation, please visit us on our website, www.longevity.ucla.edu, and just click on the support tab. You should also receive an email after the webinar, which will include a recording of today's conversation and a link to where you can donate directly. So, and also before I get into the topic, just to remind you, those of you who are new to this or unfamiliar with Zoom, you'll see at the bottom of the Zoom page, there's an opportunity to pose questions by text. We got a few questions in advance. Thank you for that, and we'll hopefully have time to get to those. And feel free as we move forward in the conversation to ask some questions, because we want to engage all of you to be part of the conversation. So today the topic is caring for your mind health during a pandemic. So we get a lot of uncertainty, and that stirs up many uncomfortable feelings. We don't know about our health. We don't know how we're going to deal with this pandemic. We don't know about the financial situation. I could go on and on. And it is having an impact on our mental health. Back in March of 2020, when the pandemic was just rearing its ugly head, the American Psychiatric Association did a national poll, and they found that 36% of Americans felt that the coronavirus was having a serious impact on their mental health. 24% had trouble concentrating on things other than their pandemic worries. 19% had trouble sleeping. 12% found themselves fighting with their loved ones or partners. So it's clear that it's not just a physical threat, it's a mental threat that we're all experiencing. So today, we have a real treat, because we're going to speak with a colleague, an expert, and we're going to look at a lot of these issues. We're going to look at how the pandemic, how age affects our response in terms of our mental health. We're going to look at how prevailing over these traumatic experiences can actually have a silver lining. It can boost our psychological resilience. So our guest today is Dr. Jalil. He's an assistant clinical professor of psychiatry at UCLA in our division of geriatric psychiatry. So he's an adult psychiatrist and a geriatric psychiatrist. His clinical work and his research work focus on dementia, memory problems, late life depression, and a topic I hope we get a chance to get into, neuromodulation. Jason completed his residency here at UCLA, and then while he was there, he became chief resident in psychiatry. He then did his geriatric psychiatry fellowship at UCLA, then joined our faculty after that. On our faculty, he does clinical work. He does a lot of teaching. He's also an associate director of our Longevity Center in terms of the memory lifestyle program. Maybe we'll have a chance to talk about that as we move forward. And another thing I'd like to talk about, he's on the committee at the medical school on physician wellness, which I think is a topic we're all concerned about, because regardless of our age, we're going to see the doctor. So welcome, Jason. It's great to have you here for the conversation.
Thank you, Dr. Small. Thank you, the Longevity Center, for inviting me to such an interesting webinar. And of course, thank you to our audience for participating and submitting some excellent questions so far.
So this is a treat for me because, I feel a bit like you may not see this, I feel a little bit like I'm a mentor. I tried to talk you into coming on board, and you did, and I'm glad you did that. And you're a young man, but you have a lot of wisdom, and so I want to, in a way, we're bridging the generation gap here, just through the conversation. So, let's get into it. So you see a fair number of patients. You're seeing young adults. You're seeing older adults with mental issues. Let's start with, what do you see as the difference in terms of what younger people are struggling with versus older people?
Yeah, definitely. I mean, look, as a whole, our population is affected globally. The pervasiveness of this issue will affect every portion, every person in any socioeconomic class, any generational class. But definitely in practice, and I think in reality, I've seen a stark difference between the generations. We can start with the issue near and dear to us, our older population, either the silent generation or our baby boomers. These are folks that have already endured a lot in their lifetime. The silent generation, these were adults who were reared during an era of post-war or during the war itself and the Great Depression. They've already dealt with a lot of upheaval in their lives. And of course, that has lent itself to resilience, right? The ability to overcome adversity and to really build strength and character to overcome these obstacles as they appear in life. However, it's not to say they don't suffer from their own issues regarding the COVID crisis, namely their health, right? We know older adults are more vulnerable to the effects of COVID. Older adults will tend to be hospitalized more than younger adults if they are infected with COVID, and unfortunately have a higher mortality rate. So definitely their health is a greater concern, the health of their loved ones, especially children and grandchildren. Financial issues are less concerning because most of our older adults are already in retirement, in the phase of retirement of their life. So they tend to see the issues of finances less. Younger adults tend to kind of gear themselves more towards spending down. But one thing that I have found is accessing care. Because as you can tell right now, we're doing everything by Zoom and video conferencing and telephone. Older adults might have more difficulty accessing mental health providers or general health providers, or even accessing things like ordering groceries online or up-to-date data from the CDC and other informative sites. So that's definitely one of the biggest differences in the generations.
Let me just, I'm sorry to interrupt you, but you've got such a rich response. I want to delve a little deeper.
Sure.
Because I want to get back to, actually start with resilience. And we did promise to talk about that. It's kind of a buzzword these days, and you defined it very well, bouncing back from adversity. And I mean, do you actually see, say if you're working with an older patient, do you see them think, well, God, I had this problem before and I know how I can solve it because I dealt with it in an earlier time? Do you actually see that mental process taking place?
Yeah. I mean, certainly. I mean, we're not born with resilience, right? It's something that builds over time. And it's this positive adaptation. So it's the system's capacity to be flexible and adapt and survive. And I think many of our older adults, though we as a population may not give them credit for this, many of our older adults actually have great resilience because of their life experiences, whether having suffered through the turmoils of financial issues, once before, either in 2008 or even, way back when, difficulties with political upheavals that have been inevitable in anyone's history, no matter where you live in the world, social upheaval, family dynamics, being widowed, divorce, things of this nature, inevitably, as you get through it, do build on your character and your ability to overcome. And so, yeah, a lot of my older adults will say, yeah, I get that this is a big issue in the world, but, we got through X, Y, and Z, we'll get through this as well. It's kind of like, this isn't my first rodeo type mentality.
Sorry about that.
Yeah.
Somebody complained that the audio wasn't that good. I don't know if this is any better. Thank you for that. I just got a Q&A. So let's get back to that. Another thing you touched upon. Can you hear me okay, Jason?
I can hear you. Great. Yeah.
Okay, good. So let's talk about something else you touched upon, and that is, the concern older people have about experience. If they do get an infection, it's going to be worse. And so, when it comes to quarantining, they're going to hyper quarantine, and that seems very reasonable.
Right.
You find, this can be an issue. Say, for example, somebody with obsessive compulsive traits, tendencies. Have you noticed that? Is that kind of an issue that's more of a problem with older than younger, or not?
Well, I see that older adults with obsessive compulsive traits tend to, in a scenario like this, some have actually joked and said, well, it's kind of an even playing field now, and now the world knows what it's like to be compulsive about washing your hands, making sure you keep your groceries outside the house before you bring them in. Even some adults that wear a mask routinely prior to any of this starting. So no, I haven't noticed that it's been an uptick of those sorts of traits per se. But certainly with OCD or OCPD, the personality traits that we discussed, certainly in some younger adults, I do see that they're finding a little bit more difficulty in managing their symptoms just because they have never really dealt with something of this stature before.
Well, it sort of speaks to the resilience of older people who have been there and done that, have that attitude.
Right.
And
exactly.
when we were talking, I was reflecting on my own practice, and I do see a few younger people. And the one person who comes to mind who had struggles with being quite obsessive about getting infected was a younger person. But what certainly helped him was talking about the issues and actually becoming more informed about the reality. I think it was really shocking at first, but with time, it seems like we have a little bit understanding about it, and the more we can learn about it, we know that for example, the likelihood of getting infected by touching something is much less than spending a lot of time in an indoor area with a lot of people around not wearing masks. And that can be reassuring. That can cut down your anxiety.
Right.
Unless you're in a room without a mask with a bunch of people, that can be quite disturbing.
But one thing, Dr. Small, one thing you did touch on is, our older adults that become hypervigilant because of their concerns. I think the concerns are completely valid. I think the concerns stem from their own fears of contracting the illness. But of course, there also is a fear that society at large is not taking the issue seriously, right? And I know, some of my older adults will say, my kids just don't get it. They're not taking it seriously. They're still going out or going on trips, getting on airplanes, and here I am locked in my apartment for the last 3 months. And to that effect, I would say we kind of have to change the way we're talking about what we're doing, in that, part of all of this is social support, right? And I don't recommend isolation. I think that actually is a misnomer when we talk about social distancing. It's actually not social distancing. It should be physical distancing, but we should actually socially undistance. To many of my patients, regardless of their age, whether 18 or 101, I say, it's good to socialize. You can do it from a safe distance, either by Zoom or telephone, video chat. You can see people in the backyard, 6 feet from one another, keeping your hands to yourself and wearing a mask. You can go for a walk in public. It's really about doing these things safely. And I think the buzzword is social distancing, but really we don't recommend that, right? We don't recommend to remove yourself from the social atmosphere. Social support is so important when it comes to things like mental health, cognitive health, even physical health and resilience. And for our recovery, so to buffer ourselves from the effects of this disaster, I think in the middle of it, to be told you have to stand away from everyone, actually really cuts into our ability to adapt and to do well. And so what I would say is don't social distance, just physical distance.
So let me, it's interesting. I think that's kind of a buzz term right now, because just as we were talking, we got a couple of questions about that issue. And, before I get to those questions, we can get in a little more, but, I think the problem I've seen is in my older patients who have some cognitive impairment, maybe dementia or mild cognitive impairment, and they're in a senior facility. And the senior facilities are very concerned about spread of infection. So they're isolating in their rooms, and I see them getting worse cognitively because they can't figure out how to use Zoom or to do all this unless they have the resources for more support. It's a big problem.
Right. Yeah, I see a fair number of clients in the home, specifically at assisted living facilities, and a lot of the juggling in the last few months was how do we get them to continue to be social, despite the fact that they're essentially isolated to their room. These are facilities where you're paying for resources such as group exercise classes or art classes, book clubs. And all of a sudden you're told, you're going to sit in your room, meals are going to be brought to you in your room, and you are for 3 months, 4 months, going to be isolated. It's a huge concern and a huge issue. So a lot of the management around the last few months has been, how do we get them to socialize? And it's come down to, getting iPads in their rooms and Zooming with family members, trying to connect all the iPads on a certain floor and having them continue their own webinars and their own classes by video conferencing. And again, as I said in the beginning, one of the greatest challenges to our older population during this time is the necessity in this moment to rely so heavily on technology. For younger adults, a lot of my younger patients are like, finally, I get to see you by video. I don't have to schlep all the way to Westwood, pay for parking and all the rest. But for older adults, really the notion of having to rely so heavily on technology, one, is very impersonal. And we're talking about generations where, a handshake and warm embrace of another person is so meaningful in social interactions. And two, just that face-to-face, losing that ability really, I think, pushes the envelope when it comes to the notion of isolation.
Well, one of the silver linings, I think, of this crisis is that it's pushed telehealth into the forefront.
Right.
And, I find that a lot of our older patients like it. You mentioned the parking lot, the traffic. In our clinics, we have a much lower no-show rate.
Right.
People are showing up for their appointments because all they have to do is dial in. So I think that's positive. But there are challenges as well, and I think this is coming out. It's actually in the conversation at a national level about education, and certainly for young kids or others. The two-dimensional video education is not as impactful as going into the classroom, socializing with others. And I know you do a fair amount of teaching. What's your experience with this? What do you think?
Yeah, I mean, I have to say I have mixed feelings about it. In some ways, I think it's great because you can reach a greater audience, right? You think of the ability to sit on a video conference, and instead of just being limited to the space in a conference room, in the Semel Institute, here you are, the world is literally your platform, and you can reach out to thousands of students at once. And so in that regard, I think the ability to amass information and reach further than, the podium per se, is one of the saving graces in all of this. But for many of us, and I think this is how you're oriented in terms of your technical skill and your desire to learn. For myself, I love, write, even though everything's by computer, I love writing my notes by hand. And so inevitably something is lost when you're not sitting in a room physically interacting with a lecturer. When someone calls on you across a Zoom room, when 30 people are involved to answer a question, you could be sitting behind your computer, look up the question, answer as you wish, or you might doze off and not be really engaged. So I think it's a mixed bag, and there are mixed feelings about it. I think the benefit definitely is that you can reach more people. These webinars are recorded, your lectures can be recorded. You can always go back, do them again, or watch them over. But there's something lost in the technical details of it that I've yet to kind of hone in on.
Yeah, so I think that it's so true. I think that the isolation again is a big problem. In fact, one of the people attending right now wrote in somebody who is an older individual who's a judge and has a job downtown and has been very fastidious about social distancing and so forth, and that person feels they're missing the social connection. They want to know, should they go downtown? My first reaction is you got to feel safe before you go. I mean, right now, personally, I don't feel safe getting on an airplane. Now that may be an overreaction, but I think it's like anything. I think we have to have a certain comfort level. I mean, we're two psychiatrists talking. I remember when I was training in psychiatry, one of the first things they taught us, because we worked in a very busy downtown emergency room, make sure you feel safe when you're with that patient. Otherwise, you can't think straight.
Right. Yeah, I mean, I have a lot of family members that will be like, wow, I can't believe you still go to the hospital. I said, I can't believe you still go to the supermarket. I mean, at least, and that's speaking to knowing your surroundings, right? When you walk into the hospital, everybody's checked. They're asked if you have any fever, any symptoms. There's a temperature check. It's a known entity. There are hand washing stations. Everybody kind of is hip to the cause. But a lot of places out there don't have these safety measures in place. And so I think knowing, it's just like in a webinar, you got to know your audience. You got to know where you're going. You have to feel safe and feel comfortable. All of this comes with a caveat. You never want to jeopardize your health. And so if you're going to socially engage, you have to do it in an environment that's safe, right? We're not asking people to go and sit at the beach all day, and talk to anyone that comes strolling by. But if you know the situation you're getting yourself into, the people that you're meeting up with have equally been socially distancing, or you're wearing a face mask yourself and you have your hand sanitizer with you, and you promise to keep your hands to yourself. I think as long as you minimize the risk, really outside of that, there isn't much to be done.
So, it reminds me, I want to make a plug for UCLA on this one. Now, I haven't been back very often. First, a confession, I've been working from home pretty much. I've been in a couple times. But when I've gone in, I've been very impressed. They take your temperature, as you say, they ask you the questions, and you're not supposed to get on an elevator with anybody else. So, so those kinds of measures are reassuring to me. I think those are the kinds of changes that will help people help us all open up the country. There's
Right.
one question, I think you might have gone too quickly. Somebody asked, what is OCD? You might have said that. That's short for obsessive compulsive disorder.
Right.
Or if you're really obsessive, you call it CDO, you alphabetize the letters. But psychiatrists can joke with each other too, right? Let's talk a bit about, because there was another question about depression, and it's really the question was, I got depression, and now I got depression upon depression with all this stuff.
Right.
People
Right.
they try to do their best, but at some point we get exhausted. We just feel off. So I like it first, if you could tell people, look, we all have our ups and downs, right? And it's normal. emotional reactions. But when does somebody see a psychiatrist or a mental health professional because of their mood? And then speak a little bit to, what about somebody who has a predisposition to something like depression or anything else? How do they cope during this crisis?
Yeah, certainly. I mean, I'll start with, when to seek help. My shtick, with my patients when they first come into the office, if any of my patients are on right now, they know this. I say there's order and disorder, right? And so when we talk about psychiatry, we're really talking about the normal spectrum of human emotions and human behavior. We all at some point in our lives will feel anxious, right? It's ingrained in our DNA. It's actually can be protective in some, situations, the fight or flight response, of course, being one of them. We all will feel sadness and quote unquote depressed. We may feel, some symptoms of compulsions at times, or even a hallucination in 50% of the population can occur without the existence of psychiatric illness. Going to sleep and hearing someone call your name, and you pause and look around and say, wait, where did that come from? You know that there isn't someone hiding under your bed calling your name, so you go back to sleep. But what were to happen if those symptoms were to really insert themselves in your daily life and cause disorder, right? When your loss of function is seen, that is when depression becomes a depressive disorder, or anxiety becomes an anxious disorder. And that's when I would say the need to seek mental health care would be present. And remember, just because you show up at the psychiatrist's office, there's no guarantee you're going to get a prescription. It's really just consulting with someone who knows these symptoms, knows the impact on one's life, and is able to say, look, it sounds like you're going through a lot. This seems to be actually normal for the situation. Here's a prescription for exercise or meditation, or, hey, join the UCLA Longevity Center. They have these great webinars.
Thank you. I pay him a lot to say those things.
Or maybe we need to consider starting you on a medication. But really, I think, trusting in the process and trusting in the system and saying that I can seek out care just as I would for any other ailment. I mean, you don't just walk around with belly aches and headaches and say, oh, I'll just wait for it to pass. If they're really incapacitating and causing you to lose sleep or not function, not go to work, not engage in family or social or personal responsibilities, then you go to your doctor and you say, hey, something's up. And I think a psychiatrist should be treated no different. So that was the first part of the question. I forget what the second part was, which is a shame because I'm the associate director.
Well, I forgot too, so I should read one of my memory books. So, but we got, it's tough because I should.
That was an opportunity.
You remember
for you to plug one of the books.
Yeah, well, you're younger than I am, so you should remember better than I do. But there is so much to cover. I'm getting some great questions coming in, so I'm a little distracted. I apologize. Speaking of memory, I tell people don't multitask. And I'm forced to multitask to kind of be the moderator here. I
think what you were getting to was how do you cope with depression in the midst of all of this?
If you're predisposed to it already.
Right, and so of course, making sure your treatment plan incorporates, a backup plan for a situation like this. And I think a lot of what we're encouraging, I can honestly say for the bulk majority of my patients, we haven't necessarily upped meds or, opted for, more intensive care. It really comes down to looking at the situation and doing simple skills. Like, first of all, saying it's okay to worry in this context. I mean, we all are anxious about this situation. That's that normal anxiety I talked about, right? The question is, though, how does this anxiety serve you, right? If you are ruminating all day on the what ifs, it's actually just going to become debilitating. Your life is going to become based on worrying about the hypothetical of what happens next. But I think, in a very healthy way, you can set a small time aside each day to say, okay, when this thought comes to my mind, I'm going to couch it and readdress it at 5 o'clock in the afternoon. And for 5 minutes, I'm going to think about the things that cause me the greatest amount of distress, and filter your thoughts. This is for my worry time, and create a little container for it where it's safe to talk about, and promise it's just 5 minutes and that's it. And really, you know, a lot of this is affect labeling, right? It's, you know, the colloquial kind of term is name it to tame it. When you feel anxious about something, call it out. Say, obviously I'm anxious because, you know, Joanne is sick, and you know, Susie is MIA, and now I'm worried, and I have good reason to be worried. These are my sisters. These are my best friends. What do I do if I don't hear from them? And you come up with a strategy in your mind, and that can include worst case scenario, best case scenario, and you're just coping ahead. And by coping, you know, by coming up with worst case scenario, best case scenario for yourself, actually, even if the worst possible thing happens, the fact that you've already played it out and narrated it in your mind, you've actually dampened the response to it, the emotional response to it, right? And so I think, you know, a lot of this has to do with having a fear, acknowledging that fear, and then giving yourself an affirmation about that situation.
So, you know, Jason, that's such a nice example or description of what happens in psychotherapy, what people learn, even a little snippet of cognitive behavioral therapy. And so I think, you know, people need to know, and a lot of people don't know this, that depression is treatable. In many of these conditions, sure, we don't have a cure for Alzheimer's disease and dementia, we can help with that. But conditions like depression, many forms of anxiety, even when these mental disorders disrupt everyday life, medication, psychotherapy, or both really have an impact on people's lives. But you know, one of the big problems is tremendous stigma about getting help from a mental health practitioner. I was actually, you know, I was concerned because our topic today was mental health or mind health. I thought people wouldn't show up, but we almost had as many people register as we had for the marijuana discussion we had 2 weeks ago. So it's not, we're not quite at the cannabis level, but still, this is on people's minds. They want good information about it. And, you know, and a lot of the questions we're getting, you know, a lot of it is about interpersonal relationships. So, you know, one of them that came in advance, what is the best way, and there was another one that came in during the conversation today, very much like it. What is the best way to navigate with the spouse to agree on the proper social distancing in which friends present undue risks? I mean, so couples are not always going to agree on how to handle it.
Right. No, I mean, I certainly agree, especially as, and we had promised not to talk about these topics, but as politics gets intertwined with science or medicine, inevitably that creates a greater divide, right? And now it's not about COVID, it's about who you're voting for. And so I think, you know, and that just is exemplary of the times we're living in. I think, you know, and this comes up, I mean, I see it amongst my own friend groups and families. I think first and foremost is finding out what your, let's say, what your spouse knows about COVID and how they feel about it. I think their level of knowledge over the situation may inform their actions. It might be because they're in denial. Maybe they don't understand the ramifications, or maybe they actually truly don't believe that it's as great of a threat as it is. I think, you know, understanding where they're getting their information and where their mindset is actually will help with your kind of mental judo over trying to discuss the issue with them. And I've heard from a lot of people who have loved ones who are more vulnerable and may not be taking the risks seriously. And it's true. I mean, people who are generally healthy and younger tend to, you know, on a whole, do better in this situation and have a lower risk. But that doesn't mean they can't spread the virus to others, right? And that's actually the concern. Younger adults who may actually contract the illness may have milder symptoms or maybe even be asymptomatic, which is good for them, right? You know, they stay healthy through it, but they still are a carrier and potentially can affect others. And so, oh yeah, go ahead.
You know, this is the downside of Zoom. You don't have those natural breaks in the conversation because it's like a walkie-talkie. So I apologize if I'm interrupting you.
I'll say over and out after each statement, if that helps.
Thank you. Maybe I'm just a chronic interrupter. You need to treat me. Do you have any time in your practice for me?
Yeah.
So, you know, on the topic of what we were just discussing, someone brings this up. How does one address their safety fears when the media talks about super spreaders and others out there who may be asymptomatic? They wouldn't get caught in a temperature or a symptom check. So there's really, there's a lot of divisiveness about how to deal with this. How do people compromise or cope with it?
Yeah, I mean, I agree. I mean, it kind of stems, we were talking about this before the webinar started, and it reminded me of a case where I had a client who was asymptomatic, and I don't even know, I don't recall the exact details of why we decided to test her, but it was something in her narrative that was odd. And this was at the beginning when we still didn't, before we even knew the loss of taste and loss of smell was actually a hallmark feature of the illness. And so we tested her and we found her to be positive. And all of a sudden, it shook our world, right? Even as physicians, it was the first case I saw of someone who was truly asymptomatic and tested positive. And that was as much of a conundrum as to what to do as if she had symptoms, right? Because now I wasn't treating her per se, because she, got to go home and isolate. I was treating everyone she came in contact with. And, I think, speaking to what to do about super spreaders and people that are asymptomatic, I think it's just about being vigilant. I do think, it's not as common as maybe people think it is. I think at the same time, I do think there's willful denial of symptoms in some people. Oh, it's just the cough, it's my allergies. Like, what do you mean? You haven't had allergies for 30 years. All of a sudden you have allergies. But I think that there's just being frankly honest with one another. And I think when you're communicating with people about this, you want to make sure that this is a discussion where you are willing to listen as much as you are opposed to their political, scientific, or personal beliefs, right? If you want to guard against pressuring them, because if you turn this into an argument, you've lost, right? You're not going to get through. You're not going to get your sentiments heard. They're not going to take you seriously. I think ultimately at the bottom, at the end of this, it's saying, look, I'm concerned for my well-being. I'm concerned for your well-being. This is what I'm doing to ensure my safety. I encourage you to look at least at the resources and do the same. And if you ultimately choose not to, it doesn't change how much I love you, but maybe we can't see each other face to face, less than, the physical distancing requirements require.
It's interesting. We've talked about two ends of the spectrum, at least I'm thinking about it. At the one end are people who are deniers and just go out and make believe nothing's going to happen to them. And that can be a coping mechanism that works in some situations. On the other hand, there are people who are hypervigilant and concerned. People have allergies. They have an occasional cough. And whenever that happens in this day and age, the first thing that comes to a lot of people's mind is, oh my God, I've got it. Where's the oximeter? Do I still have a sense of smell? So there's different kinds of mental reactions that are quite interesting. This is kind of a curious thing. I'm going to delve into this. A very direct question. Dr. Small, is the pandemic isolation affecting you negatively personally? So we're taught as psychiatrists, we're not really supposed to share our personal lives. And in fact, that's a very Freudian thing, that it's, you're sort of a mirror. And if you're in psychoanalysis, it's true, the analyst will hardly say anything about this. But I think and it's true that a psychotherapeutic relationship is one where the therapist does not, they're putting aside their needs for the needs of the patient. But, psychiatrists and doctors do tend to talk about themselves. And I think sometimes that can make the practitioner more human. So I'm going to tell you a little bit, and if you feel comfortable, you can tell me how it's affecting your life. Yeah. And I will say that, it's good and it's bad. I mean, in many, I tend to be a cup half full kind of guy. I always see the positive side of things and look for solutions and so forth, and see the silver linings of all these things. And if you've been following these webinars, you hear about it. Say, well, this is a good result. You get more resilient as a result of it. But it gets to us. I think, I feel I miss socializing with people face to face. And, we've had some experiences with friends, where we distance and we'll meet in a backyard, and that's nice, but it's few and far between. And so I really miss that. And sometimes, it's like Groundhog Day. I get up in the morning, I got my smile on my face, and I go, oh God, we got to go through this again. So, and I don't know, how's it been for you?
So yeah, I mean, I will also say through all of this, I find myself being more transparent and open and revealing to my patients, namely because I think I want to let maybe I'm looking for help, but also try to show them that this is something we're all going through together. I can't help but, a patient tells me about her 3-year-old son and how difficult it is to have him home, all day, and daycare being closed. And I commiserate with her. I mean, I empathize with her because I'm in the same boat. And then the silver lining is, yeah, but how often do you get to have lunch with your son, right? 5 days a week, he's at daycare. You don't get to see him. And for me, we had our second born during the pandemic. So we just had we have a newborn at home. And so I thank you. I mean, but
I knew that, but I'll congratulate you again.
Conveniently, the crisis has allowed for a forced paternity leave. I mean, I basically got, 3-month paternity leave. Sure, I'm working from home, but as I set my own schedule, I can change it as needed. I can take half a morning off and work into the evening. I can work on a weekend. I don't have to wait for someone to open the office door for me, or, make sure, the electricity is running in the 300 Medical Plaza for me to be able to see patients. I get to manage all of that on my own. And so the autonomy, actually, I greatly appreciate. And my patients appreciate it too, because I have patients that live, in other states, some in other countries, who come specifically for their visits, to UCLA. And they're saying, wait a minute, I don't have to travel to see you. We can do it by phone. We could do it by video. You can see me on a Monday evening at, 7 p.m. your time, which is really Tuesday morning, 8 a.m. my time. That's great. And I think, again, that's the silver lining in it all. And, yeah, it's great. I have a patient who doesn't show up for a visit. I have half an hour, get to run inside, play with the boys, and come back out and, see the next one. Whereas otherwise I would be sitting in my office, reading a paper or the latest edition of the Memory Bible.
Well, you shouldn't admit to me that you're slacking on your job.
If we weren't distanced, so far, I might not have admitted it, but
there you go. As you speak, I really hear a lot of the positives. I can't help but think of that. And I think there's in terms of the sense of community that people feel, we're all struggling against a common enemy at times, despite the divisiveness. There's certainly an element of that. But I think, on point to this conversation and where it's going, we have a question here. And I'm apologizing in advance. We have this obviously is touching the nerve. We got a gazillion questions. We're never going to get to them all. But here's one. I was curious about your response. I've heard from therapists that they are in coach mode now that it's not the time for psychotherapy. What do you think about that? In other words, we're not really delving into things. We're not looking at trying to understand, but we're just coaching people.
It's like crisis management.
Exactly.
I don't necessarily agree with that. I mean, I definitely can see that being possible, and I know a fair number of therapists that are, in coach mode or crisis mode. But I think for, again, we negate the fact that many of our patients have gone through similar life experiences. Now, granted, this will hopefully be the one and only time we as a global population deal with something of this nature. But, patients have felt depressed and scared and anxious time and time again in their lives. And in fact, it's been more personal for them. This is at least something that is somewhat diluted by the fact that it's happening on a grand scale. I think actually if it were to happen only to you in your household, and you are the only one affected by it, or your household is the only one affected by it, it actually might have a greater impact on you. Say someone who receives a diagnosis of a cancer, for instance, or loses a loved one. And so what I would say is, at the beginning of this, a lot of people joke and say, "Oh, business must be booming." And I said, actually, it's not. It's pretty much the same old, same old. Most patients who are already engaged in psychotherapy or already engaged in mental health care have a sense of resilience that they've built over the years. And though it takes some retuning and sharpening of the tools in their toolbox, I think, for the most part, many of our patients aren't in crisis mode and, are adapting quite well to the situation.
So somebody asked, and I think this is a good question, I mean, how do you provide a list of sites or resources, with providers? And I'm just going to say, go online and search Semel Institute. That's the Department of Psychiatry. Lots of providers. You can also reach out to the Longevity Center. And if you don't have a internet, you can look us up and call us. And we often get calls about find a provider in the community. What I often recommend to people is a good way to find a mental health practitioner is talk to somebody you trust. If you trust your internist, that person may have a recommendation. If you have a close friend you trust, have they seen anyone? And I think that can be a good start. And if you're not, I get these requests all the time from all over the country, turn to a university medical center and a department of psychiatry or psychology where you often find people. Here's somebody, this gets back to the generation gap. They're concerned about being safe around their grandchildren. Now, you have young kids. There's a lot of conversation right now in the news about school starting up, and the young children really spread the virus as much as older people. I don't know if we have the answer to this, but what are your thoughts about mixing generations?
Yeah, so actually, this is, I think, very valid. Younger children are less prone to spread the virus, even if they actually are infected. So that's good news, right? And we don't understand why, but as far as I've been made aware, the little ones are less of a risk for being spreaders, which is why, opening up daycares and schools, though, of course, may be controversial at the current moment, there actually is data to support the safety in doing so. If as long as you can distance yourself, right? I think it's safe. I think it's great. My parents always say, like, oh, grandchildren, they're nature's, natural antidepressants. I think being social, being familial, keeping up with your obligations, right? Being present in their lives during this time shows them what resilience is, right? If they're able to look back and say, oh, I remember when we were stuck at home for 4 or 6 months, and Nana came over, and Grandma and Grandpa came over, and this, that, and the other. That shows them that you're not. That proves that you can teach resilience to younger generations, and I think we have to do our part for our children to do that.
But here's an interesting question. I even see it as a suggestion box item. I think has there been consideration to having more group therapy where seniors come together to discuss how social isolation is especially affecting them and how to cope? I think that's a great idea. That we could really promote that, and we could do it on Zoom easily. No?
Yeah. I would love to see Dr. Linda Erkley, lead a session. I don't know if she's on, but
we always volunteer someone who's not present, right?
But I do think, I mean, yeah, I mean, we, you know, a lot of our partial and hospitalization programs and outpatient programs have closed temporarily due to the crisis and have not been able to restart due to, you know, the demands of technology. But I would think it would be great to have groups where older adults can come together and talk about what they're going through.
What Dr. Jalil is referring to, Dr. Erkley, who many of you, I think, if you're a repeat offender to these webinars, met in the previous webinar. She does have some, she's doing some research on group therapy interaction and has run some groups, and we have had some groups. I think, you know, the next time we get together as a division, I think we ought to talk about that. I know there are so many seniors who have similar experiences, and a lot of the questions today were people who are isolated and trying to find ways to reach out, you know, being frustrated. And one of the questionnaires asked that, you know, one suggestion is something just from my personal life I've noticed. You know, when this thing started, I got concerned about people I hadn't talked to for years, old friends, and I reached out to them. It was lovely. You know, it's like that friendship had never gone away. And, you know, I'd encourage people who feel isolated, maybe going through their mental, you know, address book or phone book.
Right.
Think about who they can reach out to. They haven't talked to them for a while.
That's actually one great coping mechanism when we talk about radical acceptance, you know, which is, you know, basically accepting the situation as is, not necessarily agreeing with it, but choosing to let go of how things should be, and in coming from a place of openness and willingness. And part of this is saying, like, okay, I get that the situation sucks. It makes me anxious. You know, I can't see my loved ones. I'm worried about being alone. But despite all of this, and I can't change that, but what I can do is change the way I interact with my environment and using it as an opportunity. I haven't spoken to this person in 10 months. What better reason to call them than to check in because of COVID, right? You know, you were always waiting for that opportunity to call someone. This is the perfect opportunity.
You know, there's somebody asked this, is it okay to avoid other people that are overly negative and make you anxious? And
Yes.
I'll get your take, but I can't, yeah, I would say yes. You know, mental symptoms, they're as contagious as a common cold. You know, in fact, when I was studying, I don't know if in your training they did this, but we had a course in my residency they called autognosis. And it was talking about diagnosing other people by the way they made you feel, coming in tune with your own. And if you're at all empathic, if you're around someone who's depressed, it's going to make you depressed. If you're around someone who's anxious, it's going to make you anxious. Especially in this time, you want to pick and choose and try to avoid those toxic relationships. You know?
Right. Yeah.
So you know, we're getting near the end of the hour, but and I'm not going to be able to get to all the questions. I apologize for that. But there is something I did. You know, you're involved in neuromodulation. That is a form of mental health treatment. And maybe you could just in a couple minutes tell people what that is. We actually have a whole new division of neuromodulation in our department. Just kind of give us a, you know, brief summary of it so we can understand it.
Yeah. So neuromodulation is as old as psychiatry itself, right? It's actually been around since the time of Hippocrates, right? And that's basically the notion that we can change one's mind state, whether it's a depressive state, an anxious state, a manic state, a psychotic state, by means outside of traditional medicines. Namely, in the current day, we're talking about things like transcranial magnetic stimulation, deep brain stimulation, the use of psychogenic substances for the treatment of these major illnesses, and even electroconvulsive therapy. There's great promise in the effective treatment of affective or mood disorders with a variety of these treatment modalities, and especially for ones who have suffered from these ailments and are considered to be what we call treatment refractory, which is, you know, the notion that you've tried several medications or several different modalities and have not responded appropriately.
So
yeah.
To define it for people are not familiar, so transmagnetic stimulation would be using magnets like what they use in an MRI scan to alter the neural circuitry, the electricity in the brain, to try to reset it, to improve the mood.
Right. And this basically comes down, from the notion that we're basically, when we introduce medications to a patient and in their brain or their body, we are trying to change things on a very molecular level, right? You're upregulating receptors or neurochemicals in the brain, and it's really a chemical experiment that takes place in one's mind. What neuromodulation does is more of a focused approach on the circuits of the brain that are implicated in these illnesses, and either on a neuronal level or a circuit level, trying to create these changes. So the most focused would be something like transcranial magnetic stimulation, and of course, one of the most broadest treatments is electroconvulsive therapy.
So Jason, as I suspected, this hour raced by in a minute. We didn't get to everything I wanted to talk about. Hopefully we can have you back at a future date and we can delve a little deeper into these fascinating issues and see how things are going on, see how your family is growing. So again, thank you so much for taking the time.
Thank you for having me.
Share your wisdom with our community. To all of you who joined us, thank you. Thank you for the terrific questions. Sorry we didn't get to all of them. I tried to get to as many as possible. And tune in for our future webinars. If my memory is working, I believe that the next one is with Fernando Torres-Gil, who is one of our associate directors of the center, and we're going to be talking about public health issues, about ageism, and it's going to be fascinating, just like today. So thank you, and we'll see you next time.